Good morning, everyone. It's a great pleasure to have this opportunity to speak to you this morning about innovation and the role of the NHS in our country and our economy. But firstly, let me say how important I believe the NHS is. One of the, I think, greatest, if not the greatest, contribution to the well-being of our country, and one which we've seen dramatic improvement in over the last 10, 12 years, which has been in part down to the commitment and expertise of the thousands of people which make up our NHS. But it's also down to the really quite considerable increase in investment, rising from approximately £35 billion a year back in 1997 to £110 billion a year in 2010-2011. Now, that increase in investment has taken place, as we all know, in really quite benign economic circumstances. But the world changed on September the 14th last year with the collapse of Lehman Brothers. And we now face globally very different economic times, which presents for this country really quite a significant challenge. We were the leader in financial services globally. And when one looks at our economic growth and the contribution to GDP from the different sectors over the past 10 years, and then one looks forward at the forecast of GDP growth over the next 10 years, we see a very different shape. In short, what we have to do is rebalance our economy. And we need to see that those sectors which we have within this country, which have the potential to fill the gap which has been left by financial services, we absolutely depend upon them growing to provide the taxation revenue to fund the public services which we need. Part of that, our NHS. So the government is pursuing a strategy of industrial activism to identify those areas where the United Kingdom has real competitive advantage, where we can be global number one or number two, and where we see sufficient growth in those sectors to be able to deliver that closure of the gap. And let me tell you that the life sciences industry, the combination of the companies in the pharmaceutical, biotechnology and medtech sectors, represent probably the single most important growth opportunity that we have in this country. If I tell you that just within the pharmaceutical sector, a quarter of all of the R&D investment that our firms in Britain make is made by the pharmaceutical sector, I think it'll give you some sense of the importance of the contribution that they make. So the NHS itself is vitally important, not just in terms of the provision of top quality healthcare free at the point of use for all, but because it is the only customer in this country for that industry. It has its hand on the ability for that industry to thrive or not. The other thing which our analysis shows is when we look at and ask ourselves, in all of these different industries, in clean tech, life sciences, digital, what are the real unique competitive advantages that the United Kingdom has compared to other countries? The NHS is our competitive advantage in life sciences. The fact that we have, going back to 1948, the patient databases, that we've been able to follow diseases through generations, the fact that we have, through the scale of the organisation, the ability to put on large-scale clinical trials, these provide us with capacity that no other countries have. And it's very interesting, as the Obama administration is looking at the way in which healthcare is managed in the United States, looking to the UK and the example of the NHS, they see the advantage of the system which we have. Now, the government is already responding to this need, and my colleague Aradazi has been leading the charge, firstly from his next stage review, then from the drive of innovation that this fantastic event represents. there is no doubt a much greater focus within the NHS on innovation and on its role as an engine for economic growth than there's ever been. The innovation hubs, investing something like 220 million over the next 5 years. The use of the SBRI scheme to encourage the take-up of innovative products from small businesses. But I have to tell you that although today the United Kingdom is the number 2 in the world in life sciences, and today the industry is providing a very significant contribution to taxation, to GDP growth and to investment in R&D, the trends of our life science industry are negative. We are losing market share. We are losing jobs from the UK to countries overseas who are increasingly competing for this industry. Most worryingly, we're seeing the effect of the credit crunch on the smallest, most innovative companies who are seeing a really quite catastrophic lack of capital, which is preventing them being able to grow, to bring forward the innovative science which they have developed. And for me, I think having worked myself in the life sciences sector as a life science entrepreneur, what worries me most of all is that we have seen a decline in market share in clinical trials from a position in the year 2000 where in the United Kingdom we carried out about 6% of all clinical trials in the world. In 2006 that percentage was down to 2%. Now we cannot allow that trend to continue. And so back in January the Prime Minister led a summit meeting at Number 10, bringing together the heads of the life science industry with the heads of the Department of Health, the NHS and all other parts of government to identify what needed to be done. And in short, to come to the conclusion that we needed to take pretty radical action across government to change the environment in the United Kingdom to really turn around these trends. And so we set up a new approach. As many people know, one of the real challenges in government is to achieve joined-up government. And in the case of life sciences, many government departments have an impact on the environment that the companies operate in. Clearly, the Department of Health, but also the Departments for Business, the Treasury, the Department for Innovation, the universities, the research base. And so we formed a new office, the Office for Life Sciences, which was given a 6-month remit to work across government with all of those departments, with officials from all of those departments, ministers from all of those departments, to agree a plan of action to be implemented this year with the test to the industry that if government was able to come up with this plan of action and implement it successfully, that the industry would say the decline stops now. That from now on we will continue to invest in R&D within the United Kingdom. We will stop moving investments out of the United Kingdom and these trends will start to reverse. So we will be announcing this package of measures in July. I'm really grateful for the way in which all of the government departments have come together to do this. I hope that it presents an exemplar, really, for the way in which these sort of issues can be tackled across government, because we have similar sort of issues with many of our different industries and arms of government.